An IOL is an intraocular lens implant. So when we remove a cloudy lens from inside the eye, we have to replace that lens with a clear implant that will help the patient to see and to achieve their visual goals. When we implant an intraocular lens, we do that after taking detailed measurements with sophisticated technology that helps us to know the exact power and the exact type of lens implant that's going to be the best for the patient. There's a huge variety of lenses, and what makes one lens better for another for a particular patient really depends on that patient's goals and desires. And so if a patient is looking to be more free of glasses, there are certain lens technologies that are going to be better for that patient. If a patient doesn't really mind wearing glasses, sometimes they feel like they enjoy wearing glasses, that it's an accessory for them, then the lens that's covered by insurance can be a really good option, and you'll continue to wear glasses afterwards. There's a broad variety of lens implants, and what makes a lens right for one particular patient really depends on that patient's particular goals and objectives. So for example, if you're someone who bird watches and you want the best possible distance correction, there will be a certain type of lens implant that will do that. If you're somebody that does a lot of up close work and you really want to have that be your primary focus, there's a certain type of lens implant and a certain aim that will achieve that. If your goal is to be more free of glasses, there's lens implants that can help people achieve 95% freedom from glasses, even adjustable lens implants that can be fine-tuned after surgery. And so there's a broad variety of lenses, and really the right lens for an individual patient just is based on what that patient wants, and your surgeon will go over that with you and work together with you to find what will be the best fit for you personally.